Hello my dear friends, welcome to Nurses Ladder. So today in this video, I came with a very important and relevant topic specifically related to nursing excellence of NABH. So before moving into this video, I would like to request you all that if there is anyone who is new to my channel and who is interested to watch videos related to nursing education, nursing profession, and also related to nursing excellence of NABH, then you can better subscribe to my channel. And as soon as you subscribe, you have to press the bell icon for getting notifications related to new videos as soon as I publish them. So my dear friends, let's start this. So in this video, I'll be dealing with chapter 3 of NABH. So this chapter deals with management of medications, which we call in short MOM. So I will be dealing with basic concepts related to this particular chapter, because each and every chapter of NABH is so vast and you cannot complete the concepts of each and every chapter, especially the standards, the elements of those chapters are so vast and it's not easy to complete it within one video. So I will be breaking it up into different videos, and I'll talk about the important content of this particular chapter and also other chapters of NABH, so that it will be easy for you to understand. There are certain concepts which you need to know before going in depth of this particular chapter. So the first and foremost point which I would like to talk about is the training of nurses. So the clinical instructors, nursing educators, as well as quality nurses in the particular hospital are very much responsible training and supervision of the staffs related to implementation of these standards in the hospital in order to get NABH accreditation. The first and foremost point which I would like to concentrate here is training of nursing staff. All points which we need to consider when we train a nursing staff related to management of medication. So the nursing staff must be well aware about LASA drugs. So what is LASA? Look alike and sound alike drugs. So these are category of drugs which among many drugs which may look alike, as well as the names of those drugs which sound alike, which sounds similar. So this is all about LASA drugs. So when we go for accreditation of through NABH, we need to make a list of look-alike as well as sound-alike drugs in the hospital, and this has to be circulated among the staff in different departments. At the same time, these staffs have to be well aware about these drugs which are being used in the hospital, and very preferably we need to have color coding for these drugs. So the color coding of these drugs would be preferably done by the pharmacist, and this will be communicated to each and every department of the hospital. So this is all about LASA. Then if you see high-risk drugs, high-risk medications are so called because they have a very low therapeutic window. I mean to say that you need to be very careful when you administer these drugs. Sometimes if you administer more quantity, means some amount you increased of this drug by mistake, or the amount of the drug which you have to administer is reduced, then also there could be some kind of effects on the patient's body which will not be good. That means there could be some kind of adverse events which may happen due to the problem with the drug dose. So we have to be extremely careful when we are going to administer high risk medications. Example for these drugs could be psychotropic drugs, inotropes, insulin, and so on. Next is restricted antibiotics. So in a hospital, it is very important for all of us to know that there are certain categories of antibiotics which are restricted and that must not be carried forward and given to the patient. That means you need to know which are those antibiotics which are restricted within the hospital for use. And as a nurse, you must check your patient's drugs before you administer these drugs to the patient in order to avoid such kind of any untoward events. Next group of drugs which the nurses must be aware of is emergency medications. Emergency medications are those medications which we use most commonly in case of medical emergency, most specifically cardiac arrest or dysarrhythmias or like that. So these are the most common ones. Along with that, there are so many other emergency cases where we try to use emergency medications. So the main concept behind these medications is that you need to have a good storage of these medications. You need to maintain inventory of these medications. If you do not maintain it, and once you have utilized the medications during an emergency situation and you were not able to take the inventory and restore it back from the pharmacy, then you are going to be panicked. Then you will be panicked when there is an emergency situation the next time. So it is very important for all the staffs to be well aware about this situation, and inventory has to be maintained in all the 3 shifts, that is morning, evening as well as night shift, so as to maintain equal storage of these drugs in order to use them in the emergency situations. So this is all about training of staffs related to different category of drugs which we need to understand in detail related to management of. Now, the second point which I would like to highlight here is the storage of drugs. Medications are usually stored at room temperature, refrigerator. So, as soon as you open a vial, for specifically multi-dose vials in order to use for a patient, you are supposed to put the label with date and time of opening of that particular vial in order to check for the correct usage and to avoid any adverse reactions when you are going to administer the drug to the patient. This is very important. That's why I wrote here label. So other than that, if you see the refrigerator medications, the medications which are stored in the refrigerator are usually stored at a temperature of 2 to 8 degrees Celsius. And also you need to have a checklist to check the temperature of the refrigerator in all the 3 shifts. There could be some deviations in the current or the electric supply. Because of this, there could be changes in the temperature of the refrigerator, or there could be some malfunctions in the refrigerator which may also damage to the medications. So this is very important for all of us to know that refrigerator temperature has to be checked in all the 3 shifts, and checklist has to be formulated for checking this temperature. The third point here is inventory. Inventory is checking off the items which we use for the care of patients and also for the treatment purpose. In this, it includes drugs, that's medications which we give for the patients, the surgical consumables, and these drugs and surgical consumables have to be separated and they have to be kept separate in different compartments and have to be labeled. As you all know, emergency drugs have to be separated and segregated and kept in the crush cart. Each has to be checked in all the 3 shifts. The fourth point is very important. That is reporting of critical events. So reporting of critical events include that of drug reactions, medication errors as well as sentinel events. So if there is a drug reaction, if there is any drug reaction which happened, what you are supposed to do? We are supposed to inform it to the particular doctor or physician, and the doctor has to come and see the patient. Doctor has to write a report, and along with that the doctor has to put a sign and date. Along with this, we need to store the particular vial of medication which caused the drug reaction until and unless it is completely clear that it was a drug reaction. So why we have to check it? Because we have to store it, because we need to check the batch number of the drug so that the total number of drugs of the same batch could be checked and could be sold back, or it could be returned back to the manufacturer in order to avoid any events, untoward events in the future. Other than that, there is one more event, that is medication errors. I already made a video on this, on different medication errors, so I'm not going to go in detail about that. But we are supposed to report medication errors so that it will not happen in the coming future. That is very important, even if it is a near miss. Next, Sentinel Events. So what is the Sentinel event? It is an untoward incident which happens, which may result in the death, disability or harm to a patient, which could be caused by a malfunction of an equipment or due to a person-related error. That means it could be caused due to some malfunctions in the equipment or environment, or even due to the error which was caused by a healthcare professional during the treatment of the patient. So this could also happen while administering a drug which was a wrong one to a wrong patient in a wrong time. So this is very important. It's very important for all of us to know about Sentinel events and the types of those events. Last point which I would like to mention here is administration of drugs. So while you administer the drug, it is very important for all of us to label the drugs specifically in case of IV fluids. You're going to mix a drug into a IV fluid and you're going to give to the patient. Specifically, you're supposed to label the IV fluid bottle with the date and time, and also the drug which you mixed along with the dose, so that it will be easy for you to remember when it was started and when it has to be over. So this is very important for all of you to know that labeling of drug is very important. In some cases we try to store the drug. In that case also you are supposed to label the drug with the date of opening. The last point is, it's written here, rights of drug administration. This is very important. We are supposed to follow the rights of drug administration while we give a drug to a patient. So this is all about the basic concepts of management of medication. My dear friends, I hope this was useful for all of you. This is a very brief topic which I dealt in this video. This is, actually speaking, this is a very vast topic. So this is all about the basic concepts. I will deal on these topics in detail in the coming videos. So stay tuned with me. If you are interested to watch more videos like this, you can put it in the comment section so that I can make videos on that. And if you really like this video, you can press the like button and also subscribe to my channel so as to get the new videos as soon as I publish them. So my dear friends, thank you so much for your patient listening. Take care and